Hello, I'm Dr. Dagny Zhu. I'm an ophthalmologist at Envision Eye Centers in Rowland Heights, California. My interests include cataract and custom lens replacement surgery. Clareon Vivity extended depth of focus IOLs use a non-diffractive wavefront shaping technology to provide an extended range of vision with minimal visual disturbances, while Clareon PanOptix trifocal IOLs use a quadrifocal design and enlightened technology to provide a full range of vision. Some surgeons have recently begun using a mix and match approach by implanting the multifocal IOL in the non-dominant eye and extended depth of focus IOL in the dominant eye to maximize the benefits of both lenses. But studies evaluating this technique are limited. My colleagues and I evaluated outcomes of contralateral implantation of Clareon Vivity and Clareon PanOptix IOLs in this single-arm, non-interventional observational study. 50 adult subjects who underwent cataract surgery with implantation of a Clareon PanOptix IOL in the non-dominant eye and a Clareon Vivity IOL in the dominant eye and met inclusion and exclusion criteria, including post-operative absolute spherical equivalent of 0.5 diopters or less and cylinder of 0.75 diopters or less, were evaluated 3 months post-operatively for visual acuities at distance, intermediate and near, refractive outcomes, and QVID and IOL-SAT questionnaire responses. The primary endpoint of mean binocular corrected distance visual acuity was minus 0.08 logmar, with all patients achieving visual acuity of 20/20 or better. Other corrected visual acuity outcomes showed similarly positive results. Uncorrected visual acuity outcomes showed that 100%, 98%, and 90% of subjects achieved binocular visual acuities of 20/25 or better at distance, intermediate, and near, respectively. The mean binocular distance corrected and uncorrected near VA was 0.02 and 0.04 logmar, respectively. Previous published data on bilateral Acrosoft IQ Vivity implantation, either with emmetropia targeting or mini monovision, showed uncorrected near visual acuity to be in the range of 0.17 to 0.23 logmar. There were statistically significant reductions of sphere, cylinder, and spherical equivalent at 3 months postoperatively. Mean spherical equivalent and refractive stigmatism were 0.08 and minus 0.02 diopters, respectively, and refractive cylinder was 0.05 diopters or less in 95% of eyes. Questionnaire responses show that 58%, 62%, and 64% of subjects reported never experiencing starburst, halos, or glare, respectively, and most subjects reported dysphotopsias to be minimally bothersome. In the FDA registration study on bilateral Acrosoft IQ PanOptix implantation, 44%, 36%, and 49% of subjects reported never experiencing starburst, halos, or glare, respectively. Furthermore, in our study, 84% of subjects reported high spectacle independence, and 90% reported that they were satisfied or very satisfied with their vision. Overall, the majority of subjects would select the same IOL again and recommend this procedure to friends and family. In conclusion, this study revealed that mix and match implantation of Clareon Vivity and Clareon PanOptix IOLs yields excellent vision and patient satisfaction, a high degree of spectacle independence, and a low rate of visual disturbances. The mix and match approach may maximize the benefit of both lenses for patients who desire high spectacle independence and minimal nighttime dysphotopsias.